we begin with the latest on health and healing. According to Pusan National University, which is in South Korea, ginseng, which by the way we know is a superfood, has long been used in traditional medicine. The health benefits of ginseng, that's Ginseng, are largely attributed to compounds called ginsenosides, which are present in the roots and stems and the leaves of the plant. And these ginsenosides are known to prevent inflammation, diabetes, and even cancer, and can help you control blood cholesterol levels and reduce aging. Now, there are 13 known species of ginseng, but Korean ginseng, which contains the highest number of ginsenosides, is not commonly found in nature. Moreover, of the two types of ginsenosides, the more effective variety, the minor ginsenosides, accounts for only 20% of the total ginsenoside content in ginseng. As a result, the supply of ginsenosides is not very high, and generally it's so low that most of the supplements don't have it. So when you get a ginseng, make sure you get the Korean ginseng. So the team of researchers, led by Dr. Ravi Gupta and the Kokemin University, and also another group at the Pusan National University, embarked on a journey to address. And this was published in Critical Reviews in Food Science Nutrition, and they found huge amounts of data that shows that this Korean ginseng, it really has health benefits. So I won't go into all, I post the article so you can read it for yourself. But you start looking at all the different ginsengs, all of which are good, by the way. But then you go to the red root ginseng, which is a superstar, and the Siberian ginseng, which is also a superstar. Then add this ginseng in with it. It helps you. It's adaptogenic, which means it helps your body's immune system adapt to anything that it gets hit with. From the University of São Paulo, which is in Brazil, a study reveals how saline solution, that's a simple salt water solution, can inhibit replication of SARS-2. The use of hypertonic solution of sodium chloride at 1.1% reduced viral replication by 88% in tests involving infected lung cells. This was published in the ACS's Pharmacology and Translational Science journal. This is important because the study was performed in the laboratory using human epithelial lung cells infected with the virus. And that's where a lot of problems happen in the lung cells. So given the gravity of the pandemic, we believe that this research is important, and this is something that is inexpensive, $1, easy to administer, any nurse can do it, and should be immediately given. So it's the right concentration, and they found that 1.1% solution was sufficient to achieve an 80% inhibition. The Vero cells are derived from kidney epithelial cells extracted. So, anyhow, it's just one more piece of the puzzle of positive information that can help. And by the way, there was an earlier study published in the Journal of Physical Chemistry Letters that showed something similar. So, you want to get the virus in treatment early, and that's the key. Now, from the University of Texas MD Anderson Cancer Center, there's been a link shown between inflammation and pancreatic cancer development. New discovery by the University of Texas MD Anderson Cancer Center has clarified the long-established connection between inflammation and pancreatic cancer development. And this was published in today's Science. And pancreatic cells display an adaptive response to repeated inflammatory episodes that initially protects against tissue damage, but can promote tumor formation in the presence of mutant, what are called KRAS genes. So they found that approximately 95% of all pancreatic cancers supports this adaptive response, leading to selective pressure to maintain the cancer-causing mutation. So that's one more reason why you've got to pay attention to the underlying cause, inflammation. And what is that? Any amount of alcohol, sugar, any meats, refined carbohydrates, stress, toxins in the environment, they all cause inflammation. So that's something that we can engage in and turn off the inflammation. Juices turn off inflammation. Celery juice in particular. I just helped someone who had massive inflammation. I mean massive. Person was dying. Would have been dead. No question about it. And they were taking coffee. That's inflammatory. It's highly anabolic. And they were taking everything, soft drinks, everything you shouldn't do. Got them off all that. That in itself was no easy task because they were also on 5 different drugs, including OxyContin. And got them to start first day, 1 glass of juice, fresh made, celery with lemon. Second day, 2. Third day, 3. Fourth day, 4. Fifth day, 5. Sixth day, 6. Clear up to 13 glasses of fresh juice a day. Turned off all the inflammation. And that's before the supplements were added in. So just remember, celery juice, cucumbers, and watercress with celery juice helps turn off inflammation. Aloe vera, big time turns off inflammation. That would be the superstar. From Washington University School of Medicine, some really interesting research, but they think it's the first of its information. It's not, but it's important. They're saying a successful way to kill the HIV virus, bee venom. It destroys the HIV cells. So this is something that is important for all of us who care about helping people with AIDS. And scientists from the Washington University School of Medicine in St. Louis have found that by poking holes in the protective envelope surrounding HIV and other viruses, what is known as the melittin, M-E-L-I-T-T-I-N, a toxin found in bee venom, kills the human immunodeficiency virus, yet it leaves the body unharmed. This breakthrough could lead to drugs that are immune to HIV resistance, and also the development of an anti-HIV vaginal gel that can prevent the spread. So that's something. Now, right now, there are 40 million people living with the HIV virus. I would ask the people in this audience, take the time to go to GaryNall.com, go to documentaries, and download and watch The Cost of Denial. The Cost of Denial, which is the most winning documentary in the world this year. Just today. I don't talk about this, but just today we got 3 wins and 2 acceptances. And this was sponsored by the Society for the International Society for Investigative Journalism, Independent Investigative Journalism. And you see people successfully treated, by the way, using propolis as part of it, and just hundreds of items, because I created the protocols, and then 22-member medical team of board-certified physicians, from nurse practitioners, et cetera, implemented it. And we have all the medical documentation, and it shows you the 15 years of this being done, 1,200 people with full-blown advanced AIDS, many near death, not a single one died, all recovered, full health, and interesting, 18 of those people completely reversed their HIV positive, HIV negative status. They were so cured after 5 years of official 5 years without cancer and no cancer in the body, you're considered cured. Well, then got the only proven cures, and all this time, that protocol still exists. I help people all the time. I'm helping someone today who has advanced AIDS. So why can't we help these other 40 million people? Because Anthony Fauci and others who control everything on AIDS won't allow that information to get out. But you can get it out. You can share it. We had a gentleman who called the other day who said, Gary, let's find a way to get more people paying attention to the information you share. I agree. But at the end of the day, I can only do so much. I'm just one person with limited resources. Think of all of the people listening. If you downloaded The Cost of Denial and you started sharing it, because that's not me saying anything in there. That's the scientists, the physicians, the nurses, the patients, the medical records. All that is seen. It's completely transparent. We even did a press conference inviting all the world's press, all of the AIDS organizations, all of the governmental agencies involved. Not a single person showed up. Not one. We had 100 people with full-blown AIDS at the beginning who now were in recovery. Some had been cured. They were not all mine. I invited people from around the United States who were long-term survivors, but they all had something in common. Most had tried AZT, it didn't work, killed their partners frequently. They tried a natural way, and they were alive and well. And their doctors were there, and their medical records that were there. An independent scientific committee was there. Every way to answer any question, and no one. That couldn't happen by accident. You couldn't have 7,000 invitations to the media and not a single person show up. That's Anthony Fauci behind the scenes. That's the deep state and big pharma, not wanting its profits and control over a disease that they knew they would make hundreds of billions from to be bothered with. We had the solution. All they had was attacks. And you see those attacks today in Wikipedia. More on Wikipedia because, not today, but my lawsuit has been settled. I can't go into it because of the terms of the settlement, but I'm pleased with the outcome. Much more to come. So I'll discuss that on another day. Anyhow, so now they're saying that bee venom. But of course you have to look at this, because why is it that beekeepers were getting stung and then talking about the health benefits, what they didn't have, like arthritis? Their doctors have been using bee venom for arthritis. So it doesn't hurt the healthy tissue, kills the HIV cell. Also today, and by the way, this study published in the journal Antiviral Therapy came after research from Johns Hopkins Children's Center, the University of Mississippi Medical Center, and the University of Massachusetts Medical School reported that a Mississippi baby with HIV had apparently been cured only after he received antiviral therapy within 30 hours of birth. And so lots to know, but we're not sharing this information. We should. Now, from Al Marifia University in Saudi Arabia, a vegetable compound shows promise against diabetic kidney disease. And that's very common. And this was from the American Association of Anatomy annual meeting during an experimental biology session. And they talked about diabetic neuropathy, very common. It's a serious microvascular complication of diabetes mellitus and a major cause of end-stage renal disease. And they found that sulforaphane, S-U-L-F-O-R-A-P-H-A-N-E, sulforaphane, which you find in broccoli sprouts, and other cruciferous vegetables. That helps with this process. So it helps against diabetic kidney disease. Also from Rutgers Cancer Institute, New Jersey, high calcium, low lactose diet, meaning dairy, get rid of the dairy, can reduce the risk of ovarian cancer in African American women. So take your calcium and magnesium, but not from dairy, and make sure you're getting up around 800 to 1,000 milligrams, but don't take dairy, and you reduce your risk of ovarian cancer. That's important. That's the latest on health and healing, always from peer-reviewed journals.